Health is a fundamental human right. Every person deserves to live a healthy life regardless of their age, gender, race, and religion. It's World Health Day today, and the theme for the year is building a fairer, healthier world. The World Health Organization is focusing on the inequities associated with healthcare. The organization says the COVID-19 pandemic has further exposed the inequality associated with accessing affordable healthcare for persons of different social status. WHO says the sufferings and illnesses faced by some groups of people are preventable, and that it will ensure its goal of creating a healthier world is achieved by collecting reliable data, tackling inequities, and acting beyond borders. Also, the World Health Organization says it will not rest on its oars in tackling HIV Aids. Though treatment is available for the disease, the organization says its agenda is affordability and accessibility of treatment for HIV Aids. So joining me now in the studio is the CEO, Nigeria Business Coalition Against AIDS, Isaiah Wolabi. It's good to have you join me now.
Good to see you.
Great, good to see you too.
Thank you for having me.
And happy World Health Day.
Happy World Health Day.
All right, we expect our other guest, Dr. Emil Kun, to join us on Skype very soon. But I guess he'll come on as we get along. But let's start it this way. The last 1 year has drawn our attention to new dimensions where people tend to forget that there were some very serious issues, health issues we've been battling with. HIV AIDS, one of them. In fact, it's special to Nigeria, issues like Lassa fever and other things that people have been battling with. But how has COVID-19 shaped the way that people are acting, reacting, if we're narrowing it down to something like HIV AIDS?
Well, I would say the COVID-19 pandemic is not just a health challenge, it's a development and economic challenge. What that means is that it's going to affect all sectors, as we might have seen it: finance, education, technology. All sectors have seen the cut. And what that also means is that we would see an undercut in the response to other health issues like malaria, HIV and AIDS, diseases of huge economic burden. And when I say economic burden, that means diseases that cost us millions of dollars to respond to them. And I would honestly say that COVID-19 has had its own fair share in the response to this disease. And you know, a lot of people think COVID-19 has come to kill people, but before it even kills, it actually causes poverty, it makes people sick, and then it does a lot of things like
it's not just the health implications,
it's not just
socio-economic implications.
Yeah.
All right, now let's even narrow it down to the issue of the level of awareness. Recall that in the 90s, or in the mid-90s to late 90s, there was massive campaign to create awareness about HIV AIDS and all of that. In the last 20 years, at least the level of awareness among Nigerians when it comes to issues around HIV is there. We will say it's there. But we don't see that intentional campaigns against HIV AIDS the way it used to be anymore. Are people relenting, or are people taking caution when it comes to all of those prescribed precautions that one should take against HIV? Are people still taking those things?
Well, I would say in terms of progress and response to HIV, Nigeria has had good statistics over the years. From the most recent data that we have, 1.9 million Nigerians currently live with HIV and AIDS, and coming from about 3-point-something million. That's good success. But also, we must be wary of not letting down, like you're saying. Over the years, we have invested a lot into HIV awareness, counseling and testing program, and treatment, not cure. There's no cure for HIV and AIDS, but there are treatment that can suppress viral loads. We've done that, but we have seen that presently the investment in HIV has reduced also. What that means is that if we don't increase investment in HIV programs, we might lose these gains. Right now, out of the 1.9 million Nigerians who are HIV positive, about 600,000 do not know their status. And many of this population, the demography falls within young people between 15 to 45 years. What that means is that that is their most productive years. Either they are in school, trying to get into employment, or trying to create their own jobs. And HIV, just like COVID, it's also not just a health issue, it's a development and economic issue. And once we try to slow down, then the issue comes up again. And we might not even be able to use the type of funding or resources that we use to combat it to get to this point to fight it now. So we cannot afford to slow down.
Okay, now let's talk about the issue of accessibility and affordability of the HIV drugs. Talk to us about that. How readily available are the drugs, and how can people access them when it comes to being affordable?
Well, I would say that in Nigeria, for example, many development partners, the private sector, and also the government agency is doing a lot to make sure that the HIV treatment is available to everyone who approach a public health facility. What that means is a primary health center, general hospital, or a tertiary health facility. And also, the most important thing is for people to even get tested to know that they are positive. And there are so many Nigerians now, about 1.3 million of them, who are currently on treatment. About 1.3 million people who know their status. Okay. Out of that 1.3 million people, about 600,000 people are currently on treatment. But we need to find the remaining 600,000 people who do not even know their status at all. Researchers have proposed or recommended that we need to carry out about 27 million HIV tests to identify those people and link them up with treatment, which is very important.
Who will foot that bill? The federal government or
there are a couple of development partners and private sector organizations. Nigerian Business Coalition Against AIDS is mobilizing the private sector resources and funding to make sure that is complementing government efforts to support government facilities. So when an individual approaches a government facility, you get this treatment for free.
All right. Well, when we come back, I'm going to ask you about how ready you are in carrying out campaigns to let people know. But let's bring on Dr. Emil Kohn here, who is joining us on Skype. Dr. Kohn, it's good to have you join me right now. Now, let's talk about how COVID-19 has compounded the issue of HIV AIDS. Can you bring us up to speed? What do we need to know? Or how is COVID-19 rubbing off negatively and compounding the situation of those who have HIV and AIDS?
Good morning, Mike.
Good morning.
Can you hear me?
I can hear you. I was asking you a question, in fact.
Okay.
I was saying, if you can hear me, I was saying, how is COVID-19 compounding the issues of HIV AIDS?
Yeah, so like we say, COVID-19 pandemic has affected every sphere, every stratum of our lives, and the healthcare industry has not been spared, especially in HIV/AIDS programming. So the challenges of the lockdown period, the challenges on the economy, because before we had people complaining about accessibility of healthcare services as with respect to HIV/AIDS programming. Sometimes you see people tell you they don't have transportation to come to the clinic, pick up their drugs and things like that. And by the time we had the economic downturn, of course, what would you expect? But what we try to do to mitigate such things, we have some strategies like multi-month drug dispensing that we do. So when we have people that are qualified or are eligible for that, that's somebody that's stressed, that the viral load is almost not detectable, and the person is stable, does not have any clinical complaints or conditions, like 3 months drug, you can dispense on 3 months or even 6 months, as the case may be. We have community pharmacy, where you have pharmacy outlets identified where it is close to where people are residing, So instead of coming all the way and thinking of the challenges of getting transportation to your hospital nearby to go and pick up your drug, so you can just do it at the community pharmacy level. So these are the kind of interventions that, yes, COVID-19 pandemic has affected the programming, but we too are thinking ahead so that the effect is not too bad or deleterious or affecting and making the HIV is a pandemic too, making HIV cases worse for us.
Okay. Dr. Emil Kohn, I must thank you for talking to us. You're on your way on a trip and you had to stop to speak to us on this. We really appreciate you. Have a safe trip to where you're going.
Thank you.
Great. All right. Now, let me come back to you, Isaiah. I was going to ask you earlier, the issue of campaigns and trying to create awareness. How readily involved into that are you, or how ready are you and all your partners in carrying out that kind of campaign that delivered the result in the last 3 decades, I must say?
Well, I would say we're being more strategic about it, and we're using data to inform what we do. Okay. What that means is that we're leveraging on insight from data to actually identify focus area and the best approach and strategy. One of our approaches making sure that we are here today, and also making sure that we are reaching people where they would see us. So there are key target population and high-risk population groups. Many of them include people who make money from having sex, and also young people who do not have access to this information. It's also important to note that the sexual debut in Nigeria has reduced. So we have earlier sexual debut now in Nigeria. What it means is that young people now have sex at a earlier age, and we need to be than it used to be, and we need to be wary of all of these. Are they having safe sex? Are they having sex with protection? And also we need to make sure that we let young people know about the right information. Someone was just showing me an information yesterday about a center somewhere in Lagos saying this is the place where you can find a cure for HIV and AIDS. He got the cure from his dream. Some of these myths and misconceptions can be very costly in the society. So we have to invest a lot of resources, making sure that we are also giving the information in local language, pidgin, in the peri-urban communities, rural areas, urban slums. These are some centers where we can see high incidence of HIV and AIDS, and we're leveraging on different strata of communication from individual, community, institution, and to the highest level, and making sure that we're also using private sector channels. We do know that private sector have the resources and competence to communicate at the lowest and highest level.
All right. Now, so when it comes to those whom the target areas or target audience that you are referring to, for anyone who, for instance, is watching this program now and finds him or herself in that, that box or that area, how would they reach out? Who are they supposed to reach out to, and how?
Well, it depends. They can reach out to us if you go to our website, www.naibuka.org, or info@naibuka.org.
Okay.
You can send
they can
an
get
email.
The help that they need.
Yeah, there's also a national helpline, 6222.
Okay.
If you call the helpline, either you have HIV and AIDS or you want to get counseling, you can get counseling for free. People can also reach out to us to schedule counseling and testing in their community. We'll definitely be willing to work with them. And also, if you walk to primary health care facilities across Nigeria, there are people trained on sexual and reproductive health and right to provide support. And if you don't get the required support, you can actually call these helplines. We'll definitely make sure that they are connecting you to the right sources.
How is the government assisting or collaborating with you, or readily creating the enabling environment? Because the point there is, for this work that is trying to get people out of that vulnerability, at the end of the day, it is government who benefits when you have a healthy, environment or healthy population, as the case may be. So, how is government complementing all the effort of either development partners or private sector, and NGOs and all of that?
I would say, well, the government is doing so much, especially through the National Agency for the Control of AIDS, NACA. And in the last report of the USAID, NACA actually is one of the government agencies across the world which got some of the best recommendations. And that's because because most recently, development partners worked with NACA to conduct the National AIDS Indicator Survey, which is the most reliable data on HIV and AIDS in Nigeria today. And that's the data that is saying about 1.9 million people in Nigeria live with HIV and AIDS. Only about 1.3 million people know their status. About 600,000 people do not know their status. They are not aware of their status. We cannot do what we are doing today without the support of NACA. They are giving us the data. They are giving us the technical expertise. They are giving us the resources and access to community, to government hospitals, and the information on where we need to invest that will have the highest social returns on investment. If they are not doing this, I don't think that the investment will make sense.
Now, when it comes to demographic spread of this population that you're talking about, is it clear where they are more prevalent and where they are less, as the case may be, when you're putting Nigeria on a platform?
Well, absolutely.
Okay.
If you look at the demographic spread, or where we have the highest incidence or prevalence of HIV and AIDS, states like Benue State, Akwa Ibom, and some other states. So states like Lagos, definitely the prevalence is low. But in terms of statistics, if you consider population of Lagos, so you can sometimes consider that the number of people living with HIV in Lagos might be higher than the number of people who live with HIV in Benue State. But the prevalence in terms of statistics, that's the percentage, is higher compared to the population. That means if you have 1 in 10 in one state and you have 3 in 20 in another state. So 3 is more than 20, 3 is more than 1, but if you consider 1 in 10, that's almost out of every 10 person, that means 1 person has HIV and AIDS.
So how often is this review carried out to ascertain where there is effectiveness in the campaigns that you're carrying out and there is less effectiveness depending on how you are reaching out to people?
Well, I would say there's a national data repository, which is being hosted by NACA, that's National Agency for the Control of AIDS. What is also most important is that development partners need to work together to make sure that we are not replicating efforts and to make sure that we are reporting data in real time. So many people are doing things in silos, which is why, as the Nigeria Business Coalition Against AIDS, we're bringing businesses together, over 36 businesses, both local and international businesses, working together to end HIV in Nigeria. That way, we can report data in real time and use them to inform what the next step will be in terms of campaign. Where should we go? We went to this community last time. This is what we did, and this is the result that we got. What can we do to step up programs in community with high prevalence and high incidence? Because prevalence is also different from incidence. So we need to consider all of this in the strategy and approach. We also need to make sure that we are meeting young people where they are. A lot of people complain young people don't read anymore. Then don't put it in books. Put it on social media, whatever platform you think that would help them to get it. Because communication is about people understanding you and responding to you. People asking questions. So those are some of the insights that we're trying to get from the campaign and everything that we're doing. But I would say, like they say, the biggest room in the world is the room for improvement. We continue to improve.
Yeah. Now, mentioning states like Benue and Akwa Ibom, where you have the highest incidences from the statistics that you talked about, when you identify the areas where these things are more prevalent or more endemic, how do you approach, what intentional strategies do you use to approach places like that?
Well, there are a lot of things to consider. What are the social determinants that contribute to these things? And also, what's the kind of incidents or occurrence? What do you see? Do you see them mostly among women? Do you see them mostly among young people? What is the sexual health behavior or the health-seeking behavior among this group of people? Like I mentioned, one of the highest incidence of HIV that we see in Nigeria today is among sex workers. Also, among people, men who have sex with men. Also, that's among the groups where we have some of the highest incidence. And over 80 or 90% of HIV is being transmitted to sexual intercourse. So we can somehow pin it down. And also, where do we find it? Who are the key target population? And how do we get information and services to them? For some of this community, it could be social economic issue. That's one of the leading predisposing factor. For some of them, it could be access to healthcare and access to health information, especially correct health information, which is very important for these people to have access to. For some of the community, too, it could be issues related to stigmatization and right. Imagine a young person going to a health facility and they're like, oh, look at you, you're so young. Why are you coming here to ask about condoms? So that means they are getting double stigmatization, one from their community and secondly from the health facility. We also see incidences where people actually forget people living with HIV and AIDS, and then there could be mental health issue where they think that they need to take revenge on the society who has given it to them. And some of them, a very small group of them, think that they can go ahead to have unprotected sex.
As a way of deliberately...
As a way of deliberately spreading
it on.
Though, well, states like Lagos have very good law related to that. It's a crime in Lagos State for someone who is HIV positive to deliberately spread HIV and AIDS.
All right, Isaiah Wallaby, thank you so much for what you do, and thank you for talking to us on this. I believe that because of how central this message is for people out there, we'll have to arrange a time again for you to come for us to talk to the people and then create more awareness.
Thank you so much.
Thank you very much.
Yeah,
thank you.